Good afternoon. Hello, hello. So let's start this today's revision class with the quiz. We'll see the 1 mark questions. The first question is, what is meant by absolute poverty? Choice A, lack of social status. B, income inequality. C, severe deprivation of basic needs. D, inability to access luxury goods. So let's see the correct answer. The correct answer is severe deprivation of basic needs, because absolute poverty means extreme lack of essentials like food and shelter. The second question is, what is relative poverty? A, measured globally. B, compared to society average. C, lack of jobs. D, no education. Let's see to try and see the correct answer. The correct answer is compared to the society average. Explanation is relative poverty compares living standards within the society. Let's go to the next question. What is the main goal of universal health coverage? A, reduce the costs. B, free care only for poor. C, healthcare without hardship. And D, increase private hospitals. Let's see the correct answer. Healthcare without hardship. The universal healthcare ensures access to care without financial burden. Let's go to the next question. Which organization provides emergency food assistance globally? A, WHO. B, UNICEF. C, Food Program. And D, World Bank. Let's see the answer. The correct answer is World Food Program. The World Food Program provides global emergency food support. Fifth question. What is the primary objective of SDG 2, the Sustainable Development Goal number 2? Reduce inequality is A. Promote education is B. Achieve zero hunger is the C option. And improve healthcare is the D option. Let's see to understand the answer. Achieve zero hunger. SDG 2 especially focuses on hunger elimination and food security. The next question is, what is meant by absolute poverty? A, lack of social status. B, income inequality. C, severe deprivation of basic needs. And D, inability to access luxury goods. Let's try to see the answer. Correct answer is severe deprivation of basic needs. Absolute poverty means extreme lack of essentials like food and shelter. Now, the seventh question is, what is relative poverty? Measured globally compared to society average, lack of jobs and no education. Correct answer is compared to society average. Relative poverty compares living standards within the society. What is the main goal of universal health coverage? A, reduce the cost. B, free care only for the poor. C, healthcare without leadership. Increase private hospitals. Let's see the correct answer. It's healthcare without hardships. The universal healthcare ensures access to care without financial burden. Which organization provides emergency food assistance globally? WHO, UNICEF, World Food Program, World Bank. The World Food Program provides emergency food support. What is the primary objective of SDG? A is reduce inequality, B is promote education, C is achieve zero hunger, D is improve healthcare. The correct answer is SDG 2 focus on hunger elimination and food security, that is achieving zero hunger. What is meant by absolute poverty means lack of social status, in, income inequality, severe deprivation of basic needs, and inability to access luxury goods. Correct answer is severe deprivation of basic needs. Because absolute poverty means extreme lack of essentials like food and shelter. Now let's not take the questions from your question bank. You have just now got what is meant by absolute poverty. Answer is C. Severe deprivation of basic needs like food and shelter, inability to access luxury goods. What is relative poverty? Answer is B. Poverty compared to country's average living standard of living. So relative poverty exists when individuals have a lower standard of living compared to others in the community. Third question, what is a key feature of poverty health cycle? A, wealth improves the health outcomes. B, poverty reduces the healthcare costs. C, poor health and poverty reinforce each other. And health has no link to income is the last option. The correct answer is poor health and poverty reinforce each other because poor health reduces the income while poverty limits access to the healthcare, creating a vicious cycle. The fourth question is, which organization aims to end poverty globally by 2030? A is IMF, B is WHO, C is United Nations, D is World Trade Organization. The correct answer is C, United Nations, SDG 1. Explanation is Sustainable Development Goal number 1 focuses on ending poverty in all its forms worldwide by 2030. Then the next question is, what is the main goal of universal health coverage? A, reduce hospital costs. B, provide free treatment to only poor people. C, ensure access to healthcare without financial hardships. D, increase private healthcare services. Ensure access to healthcare without financial hardship. UHC ensures that all individuals receive necessary healthcare services without suffering the financial strain. Next, which of the following is a major cause of hunger? A, high agricultural productivity. B, poverty. C, technological advancement. D, urbanization. The major cause of hunger is poverty. Poverty prevents people from affording nutritious food, making it the primary cause of hunger. Then we'll see the next question, what is malnutrition? Lack of education, lack of imbalance of nutrients in the body. C, lack of employment and lack of water supply. The correct answer is B, lack or imbalance of nutrients in the body, because explanation is malnutrition includes undernutrition, micronutrition deficiency, and overnutrition affecting health. Which organization provides emergency food assistance globally? WHO, UNICEF, WFP, and World Bank. The correct answer is World Food Program. WFP, World Food Program, delivers food aid and supports nutrition programs in crisis affected regions. Now, next question is, what is the key benefit of sustainable agriculture? A. Increased pollution. B. Reduced food production. C. Long term environmental and food security. D. Dependence on chemicals. So the correct answer is C. Long term environmental and food security is the correct answer. Explanation is sustainable agriculture ensures food availability while protecting the natural resources for future generations. And let's go to the 10th question. What is the primary objective of SDG 2? A. Reduce inequality. B. Promote education. C. Achieve zero hunger and food security. D. Is improve the healthcare systems. The correct answer is C. Achieve zero hunger and food security. Explanation being this DG2 aims to eliminate the hunger, improve nutrition, and promote sustainable agriculture globally. Now let's move on to unit number 2. The first question is, what is the primary purpose of epidemiological information services? A. To provide hospital infrastructure. B. To detect disease outbreaks and guide health actions. C. To increase the pharmaceutical sales. D. To train doctors only. Answer is B. To detect disease outbreaks and guide health actions. So, explanation is epidemiological systems collect and analyze health data to detect outbreaks early and guide global health response. The second question is, which organization coordinates the Global Outbreak Alert and Response Network? GOARN. A. UNICEF. B. WHO. C. Red Cross. D. Gates Foundation. The correct answer is B. WHO, because WHO leads global outbreak coordination, and it does it through GOARN, that is Global Outbreak Alert and Response Network, to manage health emergencies. Next question is, what is the key benefit of strengthening epidemiological services? A. Increased hospital costs. B. Delayed disease detection. C. Early detection of abnormal disease trends. D. Reduced medical staff. Correct answer is C. Early detection of abnormal disease trends. Explanation is strong surveillance systems enable early detection of diseases, improving response time. Let's now move on to the fourth question. Which of the following is not a competent component of epidemiological information systems? A. Data collection. B. Data analysis. C. Data entertainment. And D. Dissemination. The correct answer is data entertainment, because it is not a component of epidemiological information systems. Core components include data collection, data analysis, dissemination, and feedback, not entertainment. The fifth question is, what is the main role of AI in epidemiological services? A is to replace the doctors, B to predict disease outbreaks, C reduce patient interaction, D eliminate vaccines. The correct answer is B, predict disease outbreaks, because AI and machine learning help forecast outbreaks using real time data analysis. Next question is, what is the major limitation of the BCG vaccine? A, it is too expensive. B, it only works in adults. C, its effectiveness decreases with age. and D, it causes severe side effects. The correct answer is its effectiveness decreases with age. The BCG vaccine protects children, but its impact reduces over time. The next question is, what strategy was key to smallpox eradication? A, mass vaccination only. B, surveillance and containment. C, isolation of doctors. And D, use of antibiotics. The correct answer is B, surveillance and containment. The WHO strategy focused on identifying the cases and containing the outbreaks rather than only mass vaccination. The eighth question is, which type of diabetes is primarily associated with insulin resistance? Type 1, type 2, gestational, and juvenile. The correct answer is type 2. Type 2 diabetes is mainly caused by insulin resistance and lifestyle factors. The ninth question is, what is the main objective of the expanded program on immunization? To promote private hospitals, to provide free medicines only, to ensure universal access to vaccines, and to eliminate doctors. The correct answer is to C, to ensure universal access to vaccines. So, explanations: EPI aims to provide immunization to all the children regardless of location or income. 10th, which challenge affects global immunization programs? A, excessive healthcare staff. B, vaccine hesitancy. C, too many vaccines. Or D, lack of diseases. The challenge that affects the global immunization program is B, vaccine hesitancy, because fear and misinformation about vaccines reduce immunization coverage globally. Let's now move on to Unit 3, in which the first question is, what does the principle of autonomy in healthcare emphasize? A, doctors' authority in treatment. B, patients' right to make their own decisions. C, government control over healthcare. D, hospital policies. The correct answer is B, patients' right to make their own decisions. Explanation: as discussed in Unit 3, autonomy ensures patients can make informed decisions without coercion. The next question is, which principle of medical ethics is associated to do no harm? A, justice. B, beneficence. C, non-malfeasance. And D, autonomy. The correct answer is C, non-malfeasance, because this principle ensures that healthcare providers avoid causing harm to patients. 3, which of the following is a major ethical concern in digital health? A, lack of medicines. B, data privacy and security. C, high donor salaries. D, manual record keeping. So, the major ethical concern in digital health is data privacy and security, because digital health raises concerns about unauthorized access and misuse of sensitive patient data. Fourth, what is the main objective of ethical healthcare governance? A, to increase hospital profits. B, to ensure fairness and accountability and transparency. C, reduce patient participation. D, promote private hospital healthcare only. The correct answer is B, ensure fairness, accountability, and transparency. Explanation is, governance ensures ethical decision making, public trust, and equitable care. The next question is, which ethical principle focus on equal distribution of healthcare resources? A, autonomy. B, justice. C, beneficence. D, integrity. The correct answer is B, justice. Justice ensures fairness in access and allocation of healthcare services. Hello. What is the key challenge in pandemic situations like COVID? A. Excess medical staff. B. Resource allocation decisions. C. Reduced patient load. And D. Overuse of technology. The correct answer is B. Resource allocation decisions, because scarcity of ICU beds, ventilators, and vaccines create ethical dilemmas. Let's now move on to question number 7. Which of the following best describes equity in digital health? A. Providing services only to urban populations. B. Equal opportunity for all to access digital healthcare. C. Limiting technology use. And D. Charging high fees. The correct answer is B. Equal opportunity for all to access digital healthcare, because equity ensures digital tool benefits all, including underserved communities. 8. What is the ethical role of nonprofit organizations in healthcare? A. Maximizing profits. B. Promoting fairness, advocacy, and access. C. Replacing governments. D. Limiting healthcare services. The correct answer is B. Promoting fairness, advocacy, and access. The NPO ensures ethical healthcare delivery, especially for vulnerable populations. Ninth, what is a major ethical issue in healthcare data handling? A. Too much of patient interaction. B. Lack of doctors. C. Data ownership and patient consent. D. Manual processing. The correct answer is C. Data ownership and patient consent. That is a major ethical issue in healthcare data handling. So, patients have the right to control the data and give consent for its use. Let's move on to the next question. Which principle is most important for ethical partnerships in global health? A. Profit maximization. B. Mutual respect and transparency. C. Political dominance. D. Limited collaboration. The correct answer is mutual respect and transparency. Ethical partnership requires fairness, accountability, and respect among stakeholders. Let's now see the first question. What is the primary purpose of healthcare laws? A. Increase hospital profits. B. Protect the patient from harm and negligence. C. Promote marketing strategies for reduce the medical staff. The correct answer is B. Protect the patient from harm and negligence. As stated in Unit 4, healthcare laws ensure patient safety, ethical practices, and accountability. Second question. Which of the following is a key component of healthcare legal regulations? A. Advertising rules. B. Licensing and credentialing of professionals. C. Entertainment policies. D. Tourism management. The correct answer is B. Licensing and credentialing of professionals, because the legal frameworks ensure that only qualified professionals deliver healthcare services. Let's now try to see the next question. What does informed consent legally require? A. Doctor approval only. B. Patient awareness and agreement to treatment. C. Family consent only. D. Government approval. The correct answer is B. Patient awareness and agreement to treatment. Explanation: patients must be fully informed about risks and options before agreeing to the treatment. There is the meaning of informed consent. Fourth, which law protects patient data and confidentiality? A. Tax law. B. Data protection and privacy laws. C. Labor law. And D. Trade law. The correct answer is B. Data protection and privacy laws. These laws safeguard the patient information from unauthorized access or misuse. Let's now go on to the fifth question. What is legal responsibility of healthcare organizations? A. Only treating the patients. B. Hiring untrained staff. C. Maintaining safe facilities and accurate records. D. Avoiding audits. Correct answer is C. Maintaining safe facilities and accurate records. Because organizations are legally required to ensure safety, proper staffing, and documentation. Now let's go on to the next question. Which consequence may arise from non-compliance with healthcare laws? Increased revenue. B. Legal penalties and loss of license. C. Better reputation. D. Reduced load work or workload. The correct answer is B. Legal penalties and loss of license because non-compliance can lead to litigation, fines, and reputational damage. The seventh question is what is the role of legal frameworks in organizations like Mayo Clinic? A. Restrict innovation. B. Ensure accountability and patient safety. C. Increase competition. D. Reduce the services. Correct answer is B. Ensure accountability and patient safety. Explanation legal frameworks support governance, transparency, and high quality care. So B is the correct answer. Ensure accountability and patient safety. Let's now move on to the eighth question. Which law encourages safe donation of food in organizations like Feeding America? A. Labor law. B. Good Samaritan Food Donation Act. C. Tax exemption law. D. Trade regulation. The correct answer is B. Good Samaritan Food Donation Act. It protects donors from liability and promotes safe food distribution. Ninth question. What is a major legal challenge in global healthcare operations? A. Lack of doctors. B. Differences in national laws and standards. C. Excess funding. D. Too many hospitals. The correct answer is B. Differences in national laws and standards because organizations must navigate varied legal systems and regulations across the countries. The next question is why is legal compliance important for nonprofit organizations? To avoid innovation, to ensure transparency and donor trust, C, to reduce accountability, and D, to increase the taxes. The correct answer is B, to ensure the transparency and donor trust, because compliance ensures ethical use of funds, builds credibility, and maintains sustainability. Let's now go on to the next unit. That's happens to be the fifth unit. The first question is what is the main purpose of ethical problem solving in hospital administration? A. Increase the hospital revenue. B. Balance the clinical, legal, and moral responsibilities. C. Reduce the staff workload. And D. Improve the marketing strategies. The correct answer is B. Balance the clinical, legal, and moral responsibilities. So that is the main purpose of ethical problem solving. The ethical decision making ensures the fairness, patient centered care, and accountability in complex healthcare environments. Which of the following is a major ethical challenge in hospital administration? A. Increasing the advertisement. B. Maintaining patient confidentiality. C. Expanding the infrastructure. D. Hiring more staff. B. Maintaining patient confidentiality. Protecting the patient data is both an ethical and a legal obligation. What is the primary goal of an ethical decision making framework? A. Speed up the decisions. B. To reduce the costs. C. Ensure consistent and fair decision making. And D. Avoid legal issues. The correct answer is C. Ensure consistent and fair decision making. Frameworks provide structured, transparent, unbiased decision making processes. Which principle focus on doing good for patients? A. Justice. B. Autonomy. C. Beneficence. D. Non-beneficence. Answer is C. Beneficence. Beneficence requires acting in the best interest of patients. The fifth one, what does the principle of non maleficence emphasize? Fair distribution of resources, B, respect for patient choices, C, avoiding harm to the patients, D, increasing efficiency. Correct answer is C, avoiding harm to patients. It ensures that decisions do not cause unnecessary harm. 6. In disaster training, doctors for you, for instance, what is triage? A. Treating all patients equally. B. Prioritizing patients based on severity and survival chances. D. Delaying the treatment. And D. Referring patients to other hospitals. Let's see the correct answer. B. Prioritizing patients based on severity and survival chances is the correct answer. Explanations: triage helps maximize the survival when resources are limited. Next question. What ethical principle ensures fair distribution of resources? A. Autonomy. B. Justice. C. Beneficence. And D. Integrity. The correct answer is B. Justice, because justice ensures fairness and equality in healthcare delivery. Next question is, what is the key ethical challenge in rural healthcare settings? The RHF. A. Excess infrastructure. B. Resource allocation with limited availability. C. High patient literacy. And D. Advanced technology. The correct answer is B. Resource allocation with limited availability. Rural healthcare often faces the scarcity of resources, leading to ethical dilemmas. Ninth question. In pediatric healthcare, what is the primary ethical concern? A. Profit maximization. B. Child autonomy alone. C. Acting in the best interest of the child. D. Reducing treatment time. C. Acting in the best interest of the child. Explanation: children are vulnerable and decisions must prioritize their welfare. 10th, what is a major ethical issue in multi organizational healthcare partnerships? A. Lack of funding. B. Conflict of interest among partners. C. Excess manpower. D. High technology value. The correct answer is B. Conflict of interest among partners. Different organizational goals can create ethical conflicts in collaboration. So, conflict of interest among partners is a major ethical issue. So, B is the correct answer. Now, this brings to the end of our one level type of questions. Now, we will see the lengthier questions, which are the 5 marks questions. In Unit 1, why is sustainable agriculture essential for achieving zero hunger? Sustainable agriculture ensures continuous food production without harming the environment, promotes the soil health, conserves resources like water, reduces dependence on chemical inputs, enhances farmers' income, and thereby ensuring long term food security and resilience against climate change. How do nonprofit organizations contribute to improved educational quality in developing countries? Nonprofit organizations contribute by building schools, training teachers, developing innovative learning programs, offering scholarships, and creating awareness about the value of education. They also collaborate with governments and international donors to reach underprivileged children and improve overall learning outcomes. How can technology help in reducing inequality? Technology can bridge the gap by providing access to online education, telemedicine, e governance services. It promotes remote and underprivileged populations connect with essential services and empowers them to participate in the modern economy. Why is sustainability important for cities? Sustainability ensures that urban areas can provide clean air, water, housing, transportation, and economic opportunities while preserving the environment for future generations. It helps balance development with social equity and environmental health. How does the ocean pollution affect the human health? The ocean pollution leads to contamination of seafood and drinking water sources. Microplastics, antitoxic, and toxic chemicals can accumulate in marine organisms and enter the human food chain, causing health issues such as hormonal disorders, digestive problems, and weakened immune systems. It also impacts mental health by threatening livelihood in coastal communities. The Unit 2 consists of the first question. The first is, why is smallpox eradication considered a global triumph? It proved that coordinated international vaccination campaigns can eliminate deadly diseases. The success was led by the World Health Organization through an intensive global vaccination campaign launched in 1967. Countries across political, economic, and ideological divides collaborated even during periods of geopolitical tension, such as the Cold War. This demonstrated healthcare crisis can transcend political boundaries where there is a shared global goal. A key strategic innovation was the ring vaccination approach, where instead of vaccinating entire population indiscriminately, healthcare workers identified the infected individuals and vaccinated all those who had been in contact with them. This efficient use of limited resources significantly accelerated containment efforts, especially in developing countries with constrained healthcare infrastructure. Why is global collaboration important in cancer care? Shared research and data accelerate innovation and ensure that equal access to treatment is given. One of the primary benefits of global collaboration is acceleration of research and innovation. Institutions, researchers, and healthcare organizations worldwide share clinical trial data, genomic information, and treatment outcomes. This enables faster discovery of new therapies, including targeted treatments and immunotherapies, which would then take significantly longer if pursued in isolation. Collaborative platforms such as those supported by the National Cancer Institute and the World Health Organization facilitate knowledge exchange and coordinated research efforts. Another critical aspect of equitable access to cancer care, there are stark disparities in cancer diagnosis and treatment between developed and developing nations. Through global partnerships and advanced medical technology, drugs and expertise can be shared with low and middle income countries. Programs such as the international funding initiatives, the NGO partnerships, and the cross border healthcare training help bridge these gaps and improve the patient outcomes worldwide. Why is rehabilitation important for people with disabilities? Rehabilitation is important because it helps people to improve the physical movement, communication, cognitive abilities, and emotional well being. It promotes independence, reduces healthcare costs, and enables individuals to participate meaningfully in education, employment, and social life. Why is ensuring access to essential medicines a global health priority? Access to essential medicines is critical for saving lives, preventing disease complications, supporting primary health care, and promoting equity. Without them, preventable illnesses can become life threatening and health systems struggle to deliver the basic care. Why is mobilizing a global fund essential for health equity in HIV and AIDS? The Global Fund mobilizes financial and technical resources to ensure that underserved and vulnerable populations have access to prevention, treatment, and care. By supporting governments, NGOs, and communities, it helps reduce the disparities, strengthen health systems, and improve outcomes in people with HIV and AIDS. Let's now go on to the next question, the Unit 3. Why is privacy considered a major ethical concern in digital health? Because digital health involves collecting and storing sensitive medical information, there is a risk of data breaches, misuse, and unauthorized sharing. Protecting patient privacy helps maintain trust, ensures compliance with laws, and upholds the dignity and rights of individuals. Second question, why is ethics considered essential in healthcare practice? Ethics ensure that healthcare professionals make decisions that respect patient rights, uphold human dignity, and promote fairness. It prevents misuse of medical authority and fosters trust between patients and caregivers. How can nonprofit organizations ensure ethical participation in the global health initiatives? Nonprofits organizations can ensure the ethical participation by training staff and volunteers on ethical standards, advocating for transparency and accountability, monitoring program compliance, and facilitating inclusive participation, and bridging the communication between the funders, the governments, and local communities. How does the executive board ensure that global health decisions remain ethical? The executive board ensures that ethical decision making by following equity, transparency, accountability, and human rights principles. It consults experts, uses evidence based analysis, publishes reports for transparency, and reviews all the proposals for ethical impact. These processes protect fairness and integrity in global healthcare governance. Why is international collaboration essential for ethical pandemic responses? No single country can handle global healthcare crisis alone. Collaboration ensures fair access, resources, rapid data sharing, coordinated response strategies, and protection of vulnerable populations, promoting equity, justice, and global solidarity. The Unit 4, the first question is, what challenges might arise when religious principles conflict with secular healthcare laws? The challenges may include restrictions on certain procedures or treatments requiring careful navigation to remain compliant with while upholding the faith based values. Why is risk management important in emergency healthcare delivery? It helps to identify the potential legal and operational issues early, ensuring safety, accountability, and continuity of care during disasters. So, risk management becomes important. Why must medical donations comply with both the legal and ethical standards? The legal compliance ensures the safety and legitimacy, while the ethical standards ensure the fair, need based, and culturally appropriate distribution of resources. Why is compliance with global healthcare laws important for philanthropic organizations? Compliance ensures the programs are legally, ethically, and safely implemented across the countries, protecting the beneficiaries and maintaining credibility with donors and partners. Why is compliance with employment laws critical in healthcare organizations? Compliance ensures employee protection, patient safety, ethical workplace practices, and prevents legal disputes and penalties. Let's now go on to the last unit, that is the fifth unit. The first question is, why is ethical decision making more complex in disaster and emergency healthcare? Ethical decision making is more complex in disaster and emergency healthcare because of limited resources, high patient volume, unsafe environments, and need for rapid decisions that directly affect life and death outcomes. Why are ethical approaches important in maternal and pediatric care? Ethical approaches ensure that mothers and children receive safe, fair, and respectful care and protect the rights and promote the trust between the healthcare providers and communities. Why is community participation important in community based research? Community participation ensures the research is relevant, culturally appropriate, and beneficial to the people involved, while also building trust and improving the success of healthcare interventions. Why is patient autonomy important in healthcare? Patient autonomy respects individuals' rights to make informed decisions about their own healthcare, ensuring dignity and trust in healthcare systems. What are the future trends in ethical problem solving in healthcare? The future trends include the use of artificial intelligence, data health technologies, data driven decision making, and increased focus on patient centered care. Some of the 10 mass questions are taken from Unit 1, that are the first one being, discuss the interrelationship between poverty and healthcare, analyze how global healthcare initiatives and non-profit organizations contribute to breaking the poverty cycle with suitable examples. You're required to answer in 10 marks. The second question is, explain the concept of zero hunger and food security, evaluate the causes of hunger, and examine the role of sustainable agriculture, then global healthcare systems and NGOs in achieving the sustainable development goal number 2. The unit 2 consists of the first question and second question. The first question being, explain the concept and importance of epidemiological information services in global health, discuss the key components, challenges, and role of non-profit organizations and technology in strengthening the global health surveillance systems. The second question being, discuss the role of global healthcare systems and non-profit organizations in advancing the disease prevention and control. Illustrate your answer with references to tuberculosis inoculation drives, an expanded program on immunization, the EPI. The third unit, the first question is, discuss the ethical dimensions of digital health with special reference to privacy, data security, equity, and accessibility. How can healthcare systems and nonprofit organizations ensure responsible use of digital technologies? Second question being, explain the concept of ethical governance in healthcare. Discuss its key principles, challenges, and the role of leadership and nonprofit organization in ensuring transparency, accountability, and equity in healthcare systems. The unit for first question is, explain the legal requirements and regulatory frameworks governing the healthcare organizations, discuss the importance of patient rights, organizational responsibilities, and compliance, and ensuring safe and ethical healthcare delivery. We analyze the legal challenges faced by nonprofit healthcare organizations operating at a national and international levels. Illustrate your answer with suitable examples related to emergency healthcare, food security, and global healthcare initiatives. The fifth and the last unit is, explain the ethical problem solving framework in hospital administration, discuss the key ethical principles involved, and elaborate on the steps in ethical decision making with suitable examples from healthcare settings. to critically analyze the ethical situations and challenges faced by nonprofit healthcare organizations in different contexts, such as disaster healthcare, rural healthcare, and urban community health. Illustrative answers with relevant case examples. This brings to the end of all the questions of Part A, Part B, and Part C. I hope and trust most of you who have gone through the Part A with the answers and Part B with the answers and Part C with the answers is already being shared with you in the classes. Kindly go through the one, take care of your health, drink lots of water, and be active when the examination is coming nearby. We also see that we would like to see you in flying colors. On behalf of SRM, I would request you to kindly go through the details of how to complete your assignments in time and submit and appear before the examinations. I wish you all the best for the forthcoming examination and all your future endeavors. Thank you. Have a nice weekend.